Right, so the initial workup for new heart failure diagnosis, of course, is a clinical syndrome with signs, symptoms consistent with impaired cardiac function, with or without cardiomyopathy. And transthoracic echo is recommended for all new presentations and recommended to obtain thereafter only if concerned for clinical or functional change. So reduced ejection fraction less than 50% and preserved ejection fraction is greater than or equal to 50%. So this change from previous where heart failure with mildly reduced ejection fraction from 41 to 49%. And of course, with all new heart failure diagnosis, recommended ischemic workup, and of course, history, physical exam, and family history, ECG, troponin, and non-invasive or invasive cardiac testing with cardiac catheterization being gold standard, and non-ischemic workup. If the ischemic workup is unremarkable in the United States, ischemic cardiomyopathy is the most common. Of course, family history, genetic testing if needed, medication history, alcohol use history, TSH, A1C, pregnancy test, of course, and iron studies, HIV testing. You can consider cardiac MRI if the ischemic testing is unremarkable, ANA if other risk factors, and trypanoid cruzi if patient has risk factors, viral panel and antimyosin antibody, urine toxicology screening, genetic testing, sarcoid, and kind of end of the line is endomyocardial biopsy if all other workup has been unremarkable. So generally the important caveat is to kind of understand why patient has new onset heart failure, as treating the underlying cause can of course change management for these patients. So finding why they have new onset cardiomyopathy, especially if it's non-ischemic, is important to a patient's treatment plan. And of course consider high output etiologies if patient has anemia and all other causes have been excluded, and thyroid dysfunction, liver failure, Paget's, and AV shunts as well. Previously, we talked about ACC-AHA stages and NYHA stages as well. Now, next, we'll be talking about dilated cardiomyopathy and its etiologies as well.